So today we're gonna start a very important topic which is related to leukoplakia. Leukoplakia is related not just to dentistry but also to the other field of medicines also. So let's start it. Bismillahirrahmanirrahim. In this we will specifically study the oral leukoplakia. So let's start it. Bismillahirrahmanirrahim. Okay. Basically, to define oral leukoplakia according to WHO, it is a white patch or plaque that cannot be characterized clinically or pathologically any other disease. Means the first diagnosis when you see a white patch in the mouth or in the oral cavity, you will diagnose as a leukoplakia. Okay, and it is basically diagnosis by exclusion. You will exclude many diseases through that. It is in white color. The cause is unknown. Many causes are the cause is unknown, but we have predisposing factors. Predisposing factors, you will study about the number one, about tobacco, alcohol, remember it. Okay, then you will read about microorganisms. Okay, then you will read about trauma, then you will read about the UV radiation, and then you will read about the sanguineria. Okay, these are predisposing factors. So one by one let's study it. Number one, it is a tobacco. Tobacco, the patient who 80% smokers or heavy smokers have leukoplakia, but it can be stopped by when they have a habit sensation. Okay, and leukoplakia cannot be scraped off it, but it can be resolved when the causative agent is removed. Okay, now alcohol. Alcohol has the synergistic effect. Synergistic effect means when it is combined with any other product, it can cause leukoplakia. 25% mouthwashes having alcohol will cause the leukoplakia. Okay, then sanguineria. Sanguineria is basically a herbal extract. Okay, herbal extract. It is basically, it has the antimicrobial, anti-inflammatory properties. Many people use it, but it has a drawback that it causes atroleukoplakia in the maxillary vestibule or alveolar mucosa or maxilla. Patient has the epithelium dysplasia. Epithelium dysplasia means that there will be a changes in the epithelium, dysplastic changes. Dysplastic changes are what? Basically, there will be a and the abnormal increase in the NC ratio in the cells. Okay, which is nucleocytoplasm ratio. Then you have pleomorphism, then you have hyperchromatisms, then you have loss of intracellular connections, loss of polarity also between the cells. Okay, and then it is irreversible, which leukoplakia is caused by sanguineria. Okay, UV radiations in patients who are exposed to UV for a very long time period, like you have farmers, or the people who are basically work outside, outside or countryside people. Most of the have the leukoplakia in their lower lip. Okay, in the lower lip, actinic chelosis. Actinic means when the patient, the people are exposed to the UV for a very long period of time. Immunocompromised patients, you have the diabetic patients, you have the deficient patients, you have blood disorders patients like leukemia, thalassemia have this leukoplakia in their mouth. Okay, microorganism, you have three microorganisms which is very important in the dentistry. It is Treponema pallidum, which cause syphilis, and Candida albicans cause candidiasis, and Humapapilloma virus, which is basically cause papilloma in of what in any part of your body. Basically, we all know it. Okay, and very important other which is not related to leukoplakia is basically we have the lactains, which basically causes the what we say dental caries basically. Okay, next we are moving towards the trauma, nicotine stomatitis, and fractional keratosis. Fractional keratosis is basically related to the mechanical means where a sharp tooth or a denture cause continuous irritation to the mucosa, so it can cause the fractional keratosis. Okay, now these are the predisposing factors that cause the might be leukoplakia. This is not a very direct cause of leukoplakia. Okay, so what we have studied till date, you have studied about the tobacco, you have studied about the alcohol, you have studied about the UV radiation, you have studied about the sanguineria, you have studied about the microorganisms, you have studied about the trauma. Okay, yeah, there are 6 causative agents. Okay, thank you.